gyrus, or dorsal and ventral is, I don't know. Anyway, one of those two. And then the ventral part of this, the ventral gyrus, heads into the transverse colon, which runs cranial to the cranial mesenteric artery. Colon right here. And the bovine, it makes a little sigmoid loop right before the pelvis. You don't see that in the goat very much, so we really don't have that to show. A couple of notes about the liver here. The liver is rotated up on the right side, so the right side is up and the left side is down, so that's all right lobe there. And then you can see we pulled away the diaphragm so you can see the parietal surface. The triangular ligament, the right triangular ligament is way up on top here. The left triangular ligament is down ventral, since the left lobe is located down, and you can really just basically palpate that. If we look now on this surface, first of all, you can see the caudate process of the caudate lobe is way, just got a pocket right there. It kind of fuses with everything. It's up there by the kidney, like it usually is. And then you can see the gallbladder. You see the quadrate lobe, right there, that small lobe. And then between the quadrate lobe and the left lobe, as is usually the case, you see the falciform ligament. It's kind of a tiny little thing right there, but that's the falciform ligament. The gallbladder is usually between the caudate and the quadrate lobe and the right lobe of the liver. The ventral lobe then is down there. And let's see, we cover, portal vein. You can see all the portal vein entering into the hilus of the liver right there. Caudal vena cava would be up above it. So, okay. So quick items here. The omasum in the goat is quite distinctive. That's omasum right there. And you have to be a little bit careful because the rumen, of course, is very extensive, and then the goat is very well developed. Then the apomasum is all of that down there. You see the curvature. We're looking lesser curvature there, and the lesser omentum would be. So that would be where you would palpate that torus pyloricus then. You can see the duodenum coming out of that pylorus off of the lesser curvature. Then the lesser omentum is all of that stuff. That pig's ear was that little flap of tissue. There you go, hanging off of that lesser omentum, actually, kind of. There we go. And you can use that to do an omentopexy and suture that into the incision. Then we look at looking through here, one thing I want to point out real quickly, we noticed that there's a kind of a loop of reticulum showing through. It's even showing through on the right side here, so don't get that confused with the apomasum. We are working on this is a new session here, we're working on the lateral aspect of the gluteal area and rump area, and there's the gluteal biceps is just a whole big thing that's where the superficial gluteal is fused with the biceps. The biceps has 3 heads. One head looks like it's part of the semitendinosus initially, but that's really a part of the biceps, okay? And then the middle gluteal is way up here. You can see it coming right in through there. And we've now reflected the gluteal biceps. Now we're looking down the sacroiliac ligament, and that's that shiny stuff. And then you can kind of see the caudal cutaneous, or the caudal gluteal nerve right there. That's about all we can see at this point. They tell you to look for the caudal cutaneous femoral, which Popesco says comes way down in this area. So anyway, it isn't really showing up here at this point. This is a little bit confusing now. We've just to get our orientation here. We're looking down on the sacroiliac ligament, and just to show you where the middle gluteal edge is. That's all middle gluteal, and then that's hiding a lot of the cranial of the greater ischiatic foramen. So it's hard to see that, but you can see a nerve coming out of there, and if you trace it back, it looks like it is coming out of that cranial ischiatic foramen, or greater ischiatic foramen. So that would be the cranial gluteal nerve, and you have to get way down underneath to really see that. And then what you do see here that it doesn't look as far caudal as it really is, but that is the lesser ischiatic foramen. That's a caudal gluteal artery and vein. And then there's a little nerve. It's hard to find with all the fat in this goat, but that's the caudal gluteal nerve. So you kind of have to palpate that tuber ischiaticum and then it's right there, and then find the ischiatic spine and then go from there. Lab guide tells us to try to find the levator and the coccygeus. The only way we can really do that is to is to transect, kind of cut this free edge of the sacroiliac ligament, flip it down and look through that, and what we're seeing is the coccygeus, which is the most lateral of the two, and we really can't see the levator at this point. Another note, they show in Popesco the complete removal of most of that middle gluteal muscle, and then you can see that greater ischiatic foramen with the sciatic nerve emerging from it, but at this point, without removing that, you really can't see that. A little more dissection here, and with a little more dissection, just reflecting that sacroiliac ligament, and you can now see what looks to be the levator. There's the levator ani. Now we've reflected further the sacroiliac ligament, and looking down now, you can see a fairly good sized nerve, and that's the pudendal nerve. It's running along with the internal pudendal artery. And the caudorectal nerve isn't really showing up. We don't see that. That should have been up high above that, everything else dorsal to it. So you can see the middle gluteal, all that. We've reflected it, we've cut and reflected it. And you can see the accessory head of the middle gluteal, that shiny thing right there. So we've reflected it now. Also, we've cut and reflected it. And now you can see the deep gluteal down there. That's deep gluteal with the sciatic nerve running over it. And then you can see the, looks like that would be the cranial gluteal nerve. And the greater ischiatic foramen would be where the sciatic nerve is emerging there. We're now going to cut through that deep gluteal just very quickly and see if we can find the ligament around the ligament of the fangs. But basically, it will tell you to find the round ligament of the hip by hip joint by cutting through the deep gluteal. Don't do that. Wait till you start to remove the limb, because you're going to remove the left limb. You have to cut through the skin and then cut through these muscles, these medial thigh muscles. Then you can just literally, physically take the limb and pull it apart and open this up. And now we have the hip joint open, and you can really see nicely that round ligament of the hip. There's no accessory ligament like there was in the horse, but you can see the round ligament very well. So we're going to go ahead and remove the limb now. So again, the lab guide is a little bit confusing, and we really don't split the pelvis. We've just removed the limb, and it's telling everybody to find all these structures on the male reproductive tract. So basically what you end up doing is removing these caudal thigh muscles, these medial muscles, layer by layer, and we're just going to try to get down to the ischial arch, and then we're going to transect the penis at that level. Now, just to sort of, I don't know if we can get oriented and show, the scrotum is all this big mass here, and so we basically just started dissecting through the superficial structures over that scrotum, and you can see this spermatic cord coming down here. It's quite large, and then the superficial inguinal lymph node is close to that, and it's pretty prominent right there. Again, there's that superficial inguinal lymph node, and then if one goes just caudal to that and you start dissecting down through the layers, you start to see the sigmoid flexure showing up, and that's that. The retractor muscle can be shown attaching to the second part of that sigmoid flexure, and then this dorsal nerve of the penis can be seen on the dorsal aspect. That comes off the pudendal nerve. You can look at the transected penis here, and you can see the urethra. You can see the corpus spongiosum around it. You can see the corpus cavernosum. You can see tunica albuginea all the way around that, there, and around the urethra. The bulbous spongiosus muscle doesn't come this far down, so you don't see that. We're opening up the scrotum here, and we've basically just cut out a big chunk of scrotum. And the dartos is on the inside. It's kind of smooth muscle lining the inside of that skin there. You see it right there. At this point, just removing the skin and the fascia, we still have preserved the what do we call that now? Parietal tunic. Vaginal tunic used to be called tunica vaginalis communis, I think, and then the visceral tunic would still be in place underneath that. So we're going to cut through the parietal tunic and eventually through the visceral tunic and get down to the tunica albuginea. Follow the up along this scrotum and the spermatic cord and right on up here, you see we do have the superficial inguinal ring pretty well exposed here. You can see it emerging from that body wall at this point. And again, where did that scrotal lymph node go? Oh, there it is right behind that, yeah. Quick look now, we've cut through the spermatic cord all the way up to the superficial inguinal ring. We see the ductus deferens here that we have that we're pulling out. You see the mesoductus there. And then the vessels are over here, including the pampuniform plexus, and you can see the mesorchium is just that fold right there of tunic connecting to the mesoductus. The mesorchium, or the pampuniform plexus, is all this plexus of veins that you're seeing right in this area. The external cremaster muscle is very well developed here. As you cut through that, you see it, and it looks like we have an internal cremaster, which is smooth muscle, actually present on this one also. Okay, very quickly, this is in one of the last dissection sessions we'll have. We're looking at the forelimb, the bovine. This is goat, actually, goat forelimb, and just a quick review of the muscles here. We have extensor carpi radialis there, and then we have the common digital extensor there, but there's two parts of that. There's a medial and a lateral belly. You can see the tendons splitting there. And it's the medial belly that's the main one. That's the one that goes down and splits in. Oh, it's the lateral one that's the main one? Okay, the lateral belly, that's the main one. The medial one just goes to P2, to the second phalanx of the third digit. And then the lateral belly splits into two parts and goes all the way to the extensor processes of P3. The lateral digital extensor is there, and it goes down to the second phalanx of the fourth